Your sacroiliac joints, or your SI joints for short, are two very large joints that join your pelvis to your spine on either side. They are one of the most stable joints within your body, with a very limited amount of motion and supported by very strong ligaments and muscles. Pain in these joints is one of the most common causes of pain in the lower back, particularly when it's on one side of the spine. In this video, I'm going to go through my top 3 exercises that are designed to strengthen the muscles to help stabilize these joints. Let's begin. Pain in the SI joint can be caused by one or two things. Either the joint's going to be very restricted and have a lack of motion, and therefore it's going to need releasing through a chiropractic adjustment, or the joint has become very unstable and therefore it needs stabilizing. And this is what we're going to go through in this video, is how to stabilize the muscles surrounding this joint. So one of the first exercises that I would recommend is going to be a glute bridge with a Thera band. If you haven't got a Thera band already, I'll put a link in the description of one that you can use. Essentially what you're going to do is simply place the band just above your knees, then lie on your back with your feet flat on the floor, and then you're just going to bring your pelvis up. Now the idea of the Thera band is it's going to try and bring your knees in. So your job is to keep your knees straight, to not allow the Thera band to pull your knees in, and by pushing out on this Thera band, you're going to be stimulating the muscles that are on the side of your hips that we call the gluteus medius. By lifting up your pelvis, we're going to be stimulating your gluteus maximus, which is more on the back of your buttocks. I would suggest doing around 10 to 12 reps up and down, nice and slowly, and then repeat this 3 times every single day, or at least 5 times a week. The second exercise that I'll recommend is more specifically going to stimulate the gluteus medius muscle that's located on the side of your buttocks. So this one is called a crab walk. So what you're going to do is tying the Thera band again around just above the knees. We're going to, as the name suggests, walk sideways like a crab. You're going to make sure that you're leading with your knee and that you're not leading with the body or your feet. I would suggest going 10 steps in one direction and then changing to the other direction, really trying to isolate the gluteus medius muscle and not using any other muscle. The third exercise is going to be another way to stimulate the gluteus medius. What you're going to do here is lie on your side, keep your knee as straight as possible, and then very slightly point your toes towards the floor. Then just bringing your whole leg up towards the ceiling, nice and slowly, and then slowly back down again. You can repeat this 10 to 12 times and do this for 3 sets. So as I said, these exercises will be really great if you do have an instability in the SI joint. It will help to stabilize that joint when you go through different movements and activities throughout your day. So give it a try. You need to give it a try for probably at least 4 to 6 weeks until you see some good changes within the area. So at least trial it for that amount of time to see if you can get the results that you're looking for. Do hit that like button if you found some good value from this video. Subscribe for new videos every single week, and I will see you next time.